Hi friends, I'm Dr. Jivram. Today I will discuss about the schizophrenia and its treatment. In this picture you can see the clear difference between healthy and schizophrenic brain. This is another picture how schizophrenia is explained in this picture. Symptoms of schizophrenia: positive symptoms, delusions, hallucinations, disorganized speech. Negative symptoms: flattened affect, reduced speech, lack of initiative. Symptoms of schizophrenia in children: delusions, flat affect, bizarre behavior, hallucinations, paucity of speech or thought, disorganized thinking. Now I will discuss a brief introduction to schizophrenia. Introduction: Schizophrenia is a chronic, severe, disabling and challenging brain disorder that makes it difficult to distinguish between what is real and unreal, think clearly, manage emotions, relate to others, and function normally. Schizophrenia is a brain disorder that affects the way a person acts, thinks, and sees the world. People with schizophrenia have an altered perception of reality, often a significant loss of contact with reality. Sometimes people with schizophrenia seem perfectly fine until they talk about what they are really thinking. Prevalence: affects men and women equally. It occurs at similar rates in all ethnic groups around the world. Men tend to experience symptoms a little earlier than women. Most of the time, people do not get schizophrenia after age 45. Schizophrenia rarely occurs in children. Most cases of schizophrenia appear in the late teens or early adulthood. However, schizophrenia can appear for the first time in middle age or even later. Schizophrenia also tends to be more severe in men than in women. Etiology: genetic causes of schizophrenia. Individuals with a first-degree relative parent or sibling who has schizophrenia have a 10% chance of developing the disorder, as opposed to the 1% chance of the general population. But schizophrenia is only influenced by genetics, not determined by it. Environmental causes of schizophrenia. Inherited genes make a person vulnerable to schizophrenia, and then environmental factors act on this vulnerability to trigger the disorder. High levels of stress are believed to trigger schizophrenia by increasing the body's production of the hormone cortisol. Other factors: prenatal exposure to a viral infection, low oxygen levels during birth from prolonged labor or premature birth, exposure to a virus during infancy, early parental loss or separation, physical or sexual abuse in childhood. Abnormal brain structure and chemistry. Enlarged brain ventricles are seen in some schizophrenics, indicating a deficit in the volume of brain tissue. Abnormally low activity in the frontal lobe, the area of the brain responsible for planning, reasoning, and decision making. Abnormalities in the temporal lobes, hippocampus, and amygdala are connected to schizophrenia's positive symptoms. Three broad categories of symptoms of schizophrenia: positive symptoms, negative symptoms, cognitive symptoms. Signs and symptoms of schizophrenia vary dramatically from person to person, both in pattern and severity. Not every person with schizophrenia will have all symptoms, and the symptoms of schizophrenia may also change over time. People with positive symptoms often lose touch with reality. These symptoms can come and go. Hallucinations. Voices are the most common type of hallucination in schizophrenia. Visual hallucinations are rare. Delusions or false beliefs that are not part of the person's culture and do not change. They may have paranoid delusions and believe that others are trying to harm them, such as by cheating, harassing, poisoning, spying on, or plotting against them or the people they care about. These beliefs are called delusions of persecution. Thought disorders are unusual or dysfunctional ways of thinking. One form of thought disorder is called disorganized thinking. Another form is called thought blocking. Movement disorders may appear as agitated body movements. A person with a movement disorder may repeat certain motions over and over. In the other extreme, a person may become catatonic. Negative symptoms are associated with disruptions to normal emotions and behaviors. These symptoms include the following: flat affect, a person's face does not move or he or she talks in a dull or monotonous voice, lack of pleasure in everyday life, lack of ability to begin and sustain planned activities, speaking little even when forced to interact. People with negative symptoms need help with everyday tasks. They often neglect basic personal hygiene. This may make them seem lazy or unwilling to help themselves. Cognitive symptoms are subtle. Like negative symptoms, cognitive symptoms may be difficult to recognize as part of the disorder. Cognitive symptoms include the following: poor executive functioning, the ability to understand information and use it to make decisions; trouble focusing or paying attention, problems with working memory, the ability to use information immediately after learning it. They can cause great emotional distress. Schizophrenia has been associated with dysregulation of many neurotransmitter systems. Dopamine therapy, dopamine D2 binding sites are increased in schizophrenic brains, while there are prefrontal D1 deficits which contributes to cognitive impairment. In addition to dopamine, serotonin, glutamate, GABA, and acetylcholine dysregulation have also been implicated in the pathogenesis of schizophrenia. At the gross level, while brain volume and gray matter volume is reduced in schizophrenic brains and ventricular volume, particularly the third and fourth ventricles, is increased. The changes in brain structure are seen only after, and sometimes prior to, onsets of symptoms and can be progressive. White matter volume is also decreased in brains of schizophrenic patients and is consistent with the cognitive deficit seen in this disease. Overactivity of hypothalamic pituitary adrenal axis is prevalent in schizophrenics, and this has been linked to an increase in the severity of the above structural changes. Schizophrenia arises from minor abnormalities in neurodevelopment such as disordered cortical neuron migration. Types of schizophrenia: paranoid, preoccupation with one or more delusions or frequent auditory hallucinations, cognitive function and affect remain manually preserved. Disorganized, characterized by disorganized behavior and speech. Catatonic, has at least two of the following features: immobility, excessive or purposeless motor activity, extreme negativism, peculiarities of voluntary movement. Undifferentiated schizophrenia does not have any of the characteristics of paranoid, disorganized, or catatonic schizophrenia. Residual schizophrenia, a continued presence of negative symptoms, more commonly known as pronounced symptoms. Diagnosis of schizophrenia is made based on a full psychiatric evaluation, medical history, physical examination, and lab tests. Psychiatric evaluation: the doctor or psychiatrist will ask a series of questions about individual or his/her loved one's symptoms, psychiatric history, and family history of mental health problems. Medical history and examination: doctor will ask about his/her personal and family health history. He or she will also perform a complete physical examination to check for medical issues that could be causing or contributing to the problem. Laboratory tests: while there are no laboratory tests that can diagnose schizophrenia, simple blood and urine tests can rule out other medical causes of symptoms. The doctor may also order brain imaging studies such as an MRI or a CT scan in order to look for brain abnormalities associated with schizophrenia. Mental health professionals use the following criteria to diagnose schizophrenia: the presence of two or more of the following symptoms for at least 30 days: hallucinations, delusions, disorganized speech, disorganized or catatonic behavior. Negative symptoms: emotional flatness, apathy, lack of speech, significant problems functioning at work or school, relating to other people, and taking care of oneself. Continuous signs of schizophrenia for at least 6 months with active symptoms. Hallucinations, delusions for at least 1 month. No other mental health disorder, medical issue, or substance abuse problem is causing the symptoms. Social strategies to cope with schizophrenia: join a peer support group, ask for feedback, consider community housing, dating and friend matching services, participate in social skills training. How to treat schizophrenia? Schizophrenia can be treated by medication, psychotherapy, patient compliance. Aims of treatment: to abolish symptoms and restore functioning to the maximum level possible to reduce the chances of recurrence. General measures: family counseling and psychoeducation, cognitive behavioral therapy for stabilized patients, supportive group therapy for patients with schizophrenia. Rehabilitation may be enhanced by assertive community programs, work assessment, occupational therapy, and bridging programs prior return to the community, appropriate placement, and supported employment. In acute attack, tablet or injection olanzapine IM or oral 5 to 10 mg, or tablet injection chlorpromazine oral or IM 100 to 150 mg 6 to 8 hourly, or tablet or injection haloperidol IM or oral 5 to 10 mg 6 to 8 hourly. Maintenance dose: tablet risperidone oral 1 to 4 mg once or twice daily, or tablet olanzapine oral 5 to 10 mg once or twice daily, or tablet chlorpromazine oral 100 to 600 mg daily in divided doses, or tablet haloperidol oral 5 to 20 gram daily, or injection flufenazine decanoate IM 25 mg monthly, or depot preparation for patients with recurrent or chronic illness aimed at improving compliance. Injection flupentixol decanoate IM 40 mg monthly. Adjunct treatment: anti-Parkinsonian drugs should only be used if reactions occur or when antipsychotics are administered at high doses likely to cause reaction. Tablet trihexyphenidyl orally 2.5 to 5 mg 8 to 24 hourly, or tablet benzatropine orally 1 to 2 mg 12 to 24 hourly, or tablet biperidone oral 1 to 2 mg 8 to 24 hourly, or injection biperidone IV 2 mg slowly over 2 to 4 minutes for acute dystonic reactions, or tablet injection promethazine hydrochloride oral or IM 25 to 50 mg, or tablet chlorphenamine orally 4 to 8 mg, or tablet or injection diazepam oral or IV 5 to 10 mg if given IV to be administered slowly, not exceeding 2.5 mg in 30 seconds. Duration of treatment: a clearly diagnosed schizophrenic patient must be on medication for at least 18 months after remission of symptoms for a first episode. After 2 or more episodes, especially if they follow within a year or 2 of each other, treatment should probably continue for life, although drug holidays may be discussed from time to time. Since a diagnosis of schizophrenia carries probable lifelong implications and treatment may be of lifelong duration, refer after treatment of acute episode, refer recurrent cases, refer patients who cannot be controlled with drugs and may require electroconvulsive therapy.